Welcome to Mind Rights 365 TV. I am your host, Jacklyn, and today we are talking about healthcare because taking care of your health is just as important as taking care of your mind, taking care of your full vessel. So you want to make sure that you have the right keys in order to take care of yourself and also to avoid being stuck with bills or responsibilities that you weren't aware of because of a lack of knowledge. So that's why today I'm talking about healthcare. I work in the healthcare system, so I know a lot about the way insurance works. And before I worked in insurance, I had no idea any of the language. It really was like Chinese to me. And so I want to break the language down to you guys in case you're having trouble with open enrollment and deciding what kind of plans you get. Okay? All right, so healthcare summary. So we know there's different type of plans. I'm going to go over the main plans that they offer. So you have your group plan, which is employer, provided by an employer. Then you have your individual. Plans, which you buy from the provider, which is whatever health coverage you're going with, or whatever provider, like Blue Cross Blue Shield, Kaiser, United Healthcare, different healthcare services. Then you have your Medicare. Medicare is for people 65 and up, or if you have been considered disabled by the government, you're considered disabled, you receive Social Security, you will also qualify for Medicare. Then we have Medicaid. Medicaid is government issue for low income. All right. Okay. So these are the four main type of sources, or the four main sources where you would get your healthcare coverage, either through your job, you buy it directly from the healthcare provider, or you're eligible for Medicare, 65 and up, or you have Medicaid due to low income. All right? So those are the four sources where you can get the insurance. Now let's talk about plans. Okay? So when we're talking about the group plan and the individual plans, they're going to offer several different types, okay? So first one that's very common people see is HMO. Okay? HMO usually only has co-payments that you pay. So for example, on an HMO plan, your doctor's visit may be $20 or $30, depending on what the copayment is. So HMO plans usually only have copayments. Now, some HMO plans also have coinsurance. Coinsurance would be, let's say you go to the emergency room and you have a coinsurance for your emergency room visits. The coinsurance will be a percentage that you pay. So like 10% or $10. That would be copayment, okay? All right, so these are the HMO plans, and that's how they operate. Now you have, which is most common for people, DHMO plans. DHMO, standing for deductible. Okay, what is a deductible? A deductible is very similar to your car insurance as well. A deductible is an amount that you have to pay out of pocket before the insurance will start paying. So this confuses a lot of people because a lot of people sign up for these DHMO plans not realizing that they have a deductible, which could be, let's say, $1,000 before the insurance will pick up and pay for any of the service that they have done. So, how can I explain that more? So, for example, let's go again with the emergency room. You go to the ER visit, you have an ER bill. Your ER bill before any insurance is $5,000. So you have a deductible of $1,000, which means that you would pay the first $1,000 of the bill, and then it's gonna switch to whatever copayment or coinsurance after you meet your deductible. So let's say the ER visit is subject to your deductible, and then once your deductible is met, it switches to a $10 copayment. So on your $5,000 ER bill, you're gonna pay $1,005. You're gonna pay your deductible in full, and then you'll pay the $5 copayment. All right. I'm gonna get back to this deductible one because this is tricky. Now, I want to talk about one more kind of plan. What was the one I wanted to talk about? No, actually, we're just gonna stick with these two because these are the main two that people have. Now, people have like high deductible plans. It's really the same thing except the deductible could be like $5,000, $6,000. On a high deductible plan, it looks like this. High. It looks something like that. High deductible plan. Then they have like self-funded, which would mean that you have to put money in it. Usually this comes with employer plans. I don't want to confuse y'all too much, so we're just gonna stick with these main two, which is the main kind of plans that they offer. Then PPO. The difference between PPO and HMO is that PPO allows you to go to various clinics. If you have an HMO, they are only going to want you to go to certain clinics that are affiliated with whatever insurance provider you decide to go with. So that's the biggest difference between the PPO and the HMO. If you got PPO and you want to go see a certain doctor, you probably can go see with any doctor that accepts PPO insurance, and your PPO insurance allows you to go to different facilities. If you HMO, you're going to have to go to whatever facilities that the insurance is saying that you need to go to, okay? All right, so, again, employer plans, you can buy individually from the healthcare provider. You can have Medicare or the Medicaid. Now, let's talk about Obamacare. What is Obamacare? Obamacare. Okay, Obamacare, a lot of people get very confused about Obamacare, which is really called the healthcare reform. I'm going to explain what Obamacare is. It's really like, Obamacare would be like a credit card company that you apply for. So let's say you go to the mall. You want to go to the mall and you want to apply for a credit card to shop at the mall, okay? So you apply with Obamacare. You're applying for like credit. Let's say you're applying for credit with Obamacare. Okay. All right. So let's say you apply for the Obamacare. Obamacare says we will pay $200 a month on your monthly insurance bill. Okay? Now you can pick whatever insurance plan you want. It's going to come from an individual provider like Blue Cross, Blue Shield, United Healthcare, Kaiser, or whatever insurance provider you decide to go with. They'll let you pick. Obamacare have all the options of all the insurance plans. But Obamacare says we're going to give you $200 a month to pay for your insurance. Okay? So let's say the insurance plan is $500. That's the natural price. So minus the $200 Obama's going to give you a month, you pay $300 a month for your insurance. And that is how Obamacare works. Simple as that. Based on your income is how they decide on how much you qualify for the Obamacare. Okay? Anybody can apply for this if you're working. If your job doesn't offer you insurance, but you still have a good income, you can still apply for this and possibly still get credit towards your monthly payments. If you don't have any income or your income is even lower than that, Obamacare will refer you to Medicaid, which is here, Medicaid, low income. They'll refer you to Medicaid. Now, misconceptions about Medicaid. Medicaid doesn't affect you anyway. It's not going to come back on your credit as far as you having it. It used to be Medicaid only qualified for women who had children, but because of the Obamacare and the new rules with the healthcare reform, anybody, male or female, with or without children, who financially qualifies for the Medicaid program qualifies to sign up. So if you're a man and you think that you can't have insurance because you don't have money or children, that is a lie. Please apply at your local Medicaid office so that you can be insured in an emergency situation. Obamacare. Now, this is only talking about the monthly premium, how much you pay per month. Monthly premiums with employers, they take it out your check every 2 weeks, so however much you get paid, they take the payments out of your check for the insurance. Individual, you're going to pay directly to the provider. Medicare and Medicaid are government-issued programs, okay? All right, let's go back to this deductible thing so that you guys can understand. Now, people always ask me, like, what's a good plan, what's a bad plan? There are no such thing as good plans or bad plans. It just depends on what you need. If you don't go to the doctor a lot, deductible could be okay for you, because it tends to be cheaper as far as the monthly premiums. And yeah, you pay more out of pocket when you go to the doctor, but if you're not going, then, and you just need it in case of an emergency, a deductible plan probably would be something that you want. If you're going to the doctor a lot, I would recommend an HMO plan, just because you won't get so many bills and you'll just pay the copayment or the coinsurance at the time, and you won't have to worry about all these bills that come with deductible plans. Now, the reason I don't like deductible plans is because in the healthcare industry, it's not that many, it's not like a set standard price for a certain thing you're going to have done. The way they do pricing in insurance is by CPT codes. CPT codes. So 925. I'm making this up. I don't know if this is a real code. Okay? This is what they look like. CPT codes. Every service in the healthcare industry has a CPT code. So like literally my elbow, it's a CPT code for the right side of my elbow, and it's a different CPT code for the left side of my elbow. And it's a different price for each one. So when you're on a deductible plan, they're going to add all those CPT codes together to find out your price. Okay? All right. So let's go over a deductible plan. Now I'm going to give you an example. Okay? So deductible. This is how they look. And then OOP max. What is the OOP max? The OOP max is your protection. It's the most that the healthcare company can charge you throughout the calendar year, no matter how many services you receive. The OOP max just tells you how much you can be charged no matter what. So I'm going to give a real dramatic deductible plan, a high deductible plan. But it's not uncommon that that's the kind of plan that you may end up choosing. So let's say this plan has a $5,000 deductible. And the out-of-pocket is $6,500, okay? All right. Okay, so now it's a little more complicated than I'm doing it now, because each service that you have is going to tell you whether it's subject to your deductible or not. Let's say on this plan we're talking of everything is subject to your deductible, everything, okay? So you go to the doctor, right? You go see your regular doctor for just a checkup. The checkup is subject to your deductible. So they're going to charge you in full. Full bill is $309 before insurance, right? So because you are a member with the insurance, they're going to break it down to what they call a member rate. Now, all of these breakdowns are random as far as I'm concerned. It's no structure to how they discount it. Or, to me, there's no structure in the pricing on the CPT codes, because they have ranges. So they can range from $500 to $1,200 on a certain CPT code. So $309 is the full price of the office visit. They give you a discount and the bill is $275. It's subject to your deductible, so you're going to pay in full the full $275, and you'll have a remaining balance and your deductible of $4,725. If I'm right. That might be right. But if it ain't, did my best. Now the $275 is also going to subtract from here. Everything you do is going to go towards the out of pocket as well. So, most important one I wanted to talk about that gets everybody confused. Oh, I forgot. Cobra. Cobra. All that is, Cobra is just, you got insurance through your employer. They fire you. They have to offer you Cobra, which is where they offer you the same insurance plan, but you pay out of pocket for it. That's what Cobra is. So every employer, you leave a job, they got to offer you Cobra. Okay? Now, you get to accept or decline on the Cobra part. Okay? All right. So I feel like we did good. We understand Obamacare, right? There's nothing wrong with Obamacare. Obamacare gives you credit to help you pay for your monthly premium. Obamacare also took away the law that they had in insurance stating that you could not get an insurance plan if you had pre-existing conditions. So that could be like, most people think it's like cancer or like you're about to die, but it could be something really simple, like you were diagnosed with something maybe that's curable, and you don't have any insurance and you try to get insurance after you've been diagnosed with this pre-existing condition. The insurance company is denying you. You ever seen the movie John Q? That is why Denzel Washington was trying to kill everybody in the hospital, because his son needed a transplant and they wouldn't let him get insurance because he didn't have insurance prior to his son being diagnosed with whatever cancer he was diagnosed with. And so when he tried to get the insurance after the diagnosis, they told him no. And so he would have to pay out of pocket for the transplant, which was obviously thousands of dollars, which he couldn't afford. And that's why they wouldn't do the transplant on his son. Just to give you some background on that. So Obamacare actually takes that away. And if you have pre-existing conditions, you can still apply for health care during the open enrollment time, which is right now, guys. I don't know if it's everywhere in the United States these dates, but right now, as it stands in California, open enrollment is October 15th to February 15th. This is mainly for this one, okay? Signing up for individual. Your job and put you in whenever they want. Now, if you don't sign up for health care during open enrollment, unless you qualify for Medicaid, you're going to be sick and you're not going to have any insurance for the whole year. Aww. You're not going to be able to get insurance until the next open enrollment. So it's very important that you're figuring out what options are available to you at this time, so that, even if you don't go to the doctor a lot, if you get in a car accident or something emergency happens to you, you don't want to end up with a bill that will exceed any out-of-pocket, which the insurance has. Remember this word here, the out-of-pocket max is your protection. Okay? When you own the insurance, no matter what happens to you, they can't charge you more than whatever the out-of-pocket max is. If you don't have insurance and you go to the ER and you rank up a big bill, you may have a $20,000 bill, and they will put it on your credit. So it's important that you figure out what your options are and have some type of coverage just in case for an emergency situation. No one can predict when they would get in a car accident or have an emergency situation where they would need to be seen by a facility. So I recommend everybody have some type of health care coverage. Again, men with no children, please apply for Medicaid. If your income meets the standards, you will be approved. So the out-of-pocket maximum. So let's go back to deductibles really quick. I'm going to just briefly go through this again because it's so important. Because every day I coach people on deductibles, and it's one of the hardest things for people to kind of get how this works. So, deductible. All right. And then OOP max. Now, if this was an HMO plan, under the deductible end, it's going to have a 0. There's no deductible. On the deductible plan, you're gonna have a deductible. Let's say it's $3,000 here, and the out-of-pocket is $5,000. That's the max you can be charged throughout the calendar year. Okay. It varies from plan to plan, so you have to pay attention to the numbers on the plan that you pick. You're gonna pay out of pocket. Let's say what's subject to the deductible on this plan. Okay. So we got a deductible plan with a deductible that's $3,000 and out of pocket that's $5,000. Not everything is subject to the deductible, just hospitalization stuff. So they say if you go to the ER, if you hospitalize, if you have surgery, it's going to be subject to your deductible, okay? So that means that if you use any one of these services, and we just put in these three, it could vary from plan to plan. Let's say the ER, hospitalization and surgery is subject to your deductible. If you use any of these services, you will pay in full until you meet that $3,000 deductible. The insurance will not pay until you pay this $3,000 deductible, okay? And then it's going to switch to whatever copayment. So next to the benefit, it'll say after deductible, after is $50, let's say for the ER, $100 for hospital, and $100 for surgery, okay? This is a good plan, actually. So that means that if I go to the hospital, they're going to charge me in full for the first $3,000. And then once I meet the $3,000 deductible, if the bill is higher than that, I'm going to pay the $100 copayment. Now, it is a one-time deductible, so once you meet it for the calendar year, you'll only pay the copayments for whatever service you're going to have up until meeting the out-of-pocket limit, which is the most that they can charge you throughout the calendar year. All plans now, due to Obamacare, have the out-of-pocket limit, which is the maximum they can charge you, no matter how many services you receive. It used to be before, when they had it where you couldn't apply with pre-existing conditions, they also had no limits to how much that they could charge you for the services. And again, they calculate those prices based on the CPT codes. CPT codes. And you can look up any code, so if you get a bill, and you see CPT codes on it, you can look up any code to get a range of the pricing. The CPT codes is how they itemize and price the billing for the deductible. If it's an HMO plan, it's just a copayment. They're going to still have the CPT codes on there, but they're going to add them up and then calculate that you only have a $10 copayment for the services. Okay? I know this is a lot of information. Please let me know if y'all have any questions. I'll be happy to answer more or do another video on whatever I missed in this particular video, but I just wanted to give a basic overview of how the healthcare system works so that you aren't confused when you're picking out the plans and you're well aware of what you're setting yourself up for by either not having insurance or picking a plan that has a big out-of-pocket to apply. Oh, let me help you guys real quick. All right, so this is it, and then I'm done. So to help you out really quick, obviously if you get insurance through your employer, they're going to offer you that. And then now you know what to look for when you see the HMO, DHMO, the high deductible, self-funded PPO. You kind of know which plan you're choosing when you go through the employer. Individual, same thing. You'll look at the different plans, see the benefits, and decide which one. Now Medicare, obviously you have to have Part A and Part B to have full Medicare. It's for people 65 and up and people who are disabled. I can do a whole video on Medicare, but not right now. We're not going to go there. But let me know if that's something y'all want or whatever y'all want me to go into more detail about. Medicaid and Obamacare. I want to talk about it. So if you're not sure whether you qualify for Medicaid or Obamacare, you can go to covered whatever the initials. I live in California, so it's going to be CA. So whatever the initials for the state, coverca.com. It's going to say health care reform. You can apply right online for your local state, and it'll let you know whether you qualify for Medicaid or if you qualify for Obamacare and how much credit they're going to give you towards whatever healthcare plan you have. There's no excuses for you not understanding the insurance. Please let me know any questions you guys have. Again, it's covered, whatever state you live in.com. to apply to see if you qualify for the Medicaid or how much credit you qualify for with the Obamacare or healthcare reform. So I hope you guys enjoyed the video. I know it's kind of boring, but health insurance is important in this open enrollment, so make sure you're covered, because you do not want to have a $20,000, $30,000 bill in collections on your name because you had to go to the ER one day. Don't let this be you. Love you guys. Have a good day.